Hi, I'm Danny Ecker with your Chicago Business Today Midday Report. Northwestern Memorial HealthCare has suffered its first quarterly operating loss in at least 4 years, a rarity for a healthcare system of Northwestern's size, underscoring the challenge of rising expenses and flattening revenue facing even the largest hospitals. Our Andrew Wong wrote this week about the road ahead for Chicago's big hospital networks. Andrew, Northwestern execs say they were expecting this, but what's the sort of the main catalyst behind this hit to the bottom line?
Well, there are sort of pressures on both ends. So there are pressures on revenue, which is for hospitals, it's serving patients, and the money comes from insurance companies and government payers such as Medicare and Medicaid. There's also a lot of pressure, upward pressure on the expense side, and those come in the form mostly of gradually increasing employee expenses like salaries and benefits.
Right, and you wrote that, I mean, there's been a dip to operating income for some of the other hospitals in the area, other hospital networks. I mean, this has been a bit across the board in terms of operating income. Is there a reason that this is sort of happening? Maybe it's more broad, and what does that mean, I guess, for maybe hospitals without the resources of some of these bigger networks?
I mean, we know hospitals, just like any other employer, it's similar to any other employer in the sense that their biggest costs are HR or employee-related costs. So we've seen that for all kinds of different employers out there in the last few years. Now, hospitals are a little different in the sense that most of their employees or their employees tend to be higher skilled, tend to demand higher salaries and better benefit packages. So that means that those types of expenses, those sort of so-called labor expenses, account for about 50%. And you're right, with hospitals that have fewer resources, smaller cushion for taking these kinds of hits, it could mean some difficult times.
Sure. And so from the standpoint of operating income for these hospitals, what's the biggest challenge ahead in terms of the impact of the Obama administration's landmark healthcare law?
I mean, there are a couple different things that are sort of coming in terms of the government payer side. This is mainly with Medicare. Of course, there's Medicaid also. There's the state of Illinois has made some cuts to the Medicaid program. On the federal level, the federal government is now penalizing hospitals for having higher readmissions rates than the average. There are other changes coming right now, of course, with the fiscal cliff. That's not necessarily with the healthcare law, but there's some cuts to Medicare being contemplated there. So that's going to cause some, if it goes through, will cause some pressure on revenue.
Okay, Andrew, thanks for the time.
Thanks, Andy.